My job makes me feel very grateful in general for the experience I get to have, because I have the opportunity to get to know families and their children so well, to the point like I sometimes feel a part of their family and a part of their worlds. We're on a first name basis and just have a conversation about what's going on in everyone's life, not just the patient, not just the parents, but just to know what's going on and help them in any way I can. I grew up in South Florida, so I grew up actually in Hollywood, Florida, where I was born and raised. I went to the University of Miami, where I studied neuroscience, and I think that's where I really started to realize that I might want to be a doctor. I started getting really involved in a social justice organization that was kind of focused on helping people, and I realized this is something I wanted to incorporate into my job. With pediatrics, I discovered that I really just liked sitting down with families and explaining kind of what it is that's going on and explaining how it is impacting their child, how it impacts their family, and understanding how it's impacting their family. There are pieces to puzzles, and you have each specialist that's a piece of that puzzle. And my job a lot of times is to help put those puzzle pieces together to paint that picture for them. A lot of babies that are born with congenital anomalies or genetic conditions, those kids tend to have the medical system involved in their life for a good portion of their life. They have visits on a weekly basis, maybe monthly. A lot of the other patients that are very dependent on medical machines, like a ventilator or like a pump for their feeds. And I think a lot of those families really benefit from palliative care in that way, because they just need that extra support while they're here or while they're at home, and to help them kind of achieve what it is that they want for their child and their future for their child. I like to think of myself as an advocate for the family. So if you have a room full of doctors, I want to sit on the side with the family, because really my goal is to voice what the parents are feeling and to give them some of the control back that I think sometimes they lose a little bit when they're in the medical system, is that they're kind of down this path and they don't always know that they have choices and they have options. Whether small or big, those options I think mean the world to them. It's all about empowering the families to have the quality of life that they hope to accomplish, whether that's a couple days of vacation here and there, to get them to a place where they feel like they can interact with their child and feel like those interactions are providing them the quality of life that they enjoy.